Okay, so I wanted to set up this series of case studies for what I do as a physical therapist with golfers. And I'm trying to introduce a few case studies, so hopefully it'll either help golfers that see this, right? So what I would consider patients or clients, what a golf pro would consider amateur player that they're trying to help, right? Or hopefully this may be able to help golf pros to understand a little bit more about how a physical therapist can be brought into your training program with a golfer, and hopefully help you to kind of get over some humps that the golfer may be experiencing either due to pain or due to physical limitations, right? So a physical therapist will come in anytime a golfer has pain. Obviously that's kind of our wheelhouse, right? But we also will come in whenever a pro sees that there is a physical limitation, either strength or mobility, that a golfer can't get rid of with either his personal trainer at the gym or YouTube videos that he's seeing, things like that. So physical therapist has that kind of expert level knowledge of what every joint should be able to do. And a TPI or Titleist Performance Certified PT will be able to apply that much better to the golf swing than the typical physical therapist down the street that has a few patients that golf, so they just kind of swing stuff and see what happens. So I want to go over a case study that I had recently with a golfer and his issues with his backswing, right? So what happened with this gentleman is that he had a history of having a stiff shoulder, right? And excuse me, one of the things that would happen was that he actually had a lack of external range of motion on the right side. And what that meant, because he was a righty golfer, he would have this chicken wing that would happen, right? That golf term that we use for when your elbow can't just stay down because your hand can't externally rotate to get up in the swing, right? So he would have that going on, and his pro was trying to get that out. And he would also have issues with back pain, right? So he came to me and he knew the shoulder thing was an issue, but he didn't know how to address it. So we gave him some stuff for that. But then the other thing that we found was an issue for him was actually in his hips. So he was complaining a lot of back pain, and he would be fine at the beginning of a round, but near the end of a round, he'd either have to stop early or he would have a lot of back pain that would cause him not to hit as well as he wanted to. And he said his major swing fault when he would try and pick up some power was that he would go inside out, right? And that's a really common issue, especially if if you're an amateur golfer, that's a really common thing. And a lot of it has to do with the physical, right? How your body is able to kind of control and manipulate itself while it's twisting. And it usually results in a slice, right? So for this gentleman, he said, everything goes, wow, all the way off the fairway. And then I'm playing from, out of bounds, right? So as we're working on this gentleman, first and foremost, easy fix was the shoulder, right? Get to stretching that, motivate him by saying, if you do that more, you'll have more of a backswing. He understood that concept, right? The big issue that he had, though, is that he had a issue with internal rotation on his trail side, right? So what internal rotation in the standing position looks like this. So this side has to turn and internally rotate. The hip has to internally rotate to be able to get you to spin backwards, to get your body to spin backwards. Now, the problem is if you can't do that, right, what tends to happen is you stop about here at the hips, and then everything comes from your back, right? So for him, that was a big portion of his back pain, was that he was having to overwork with his back. Now, add on top of that he couldn't get his hand back up and away. The problem that he was getting is if he stayed in that perfect form that all the YouTube videos tell you that you have to be at, he would stop about here, right? Well, 50-year-old competitive guy, that's not good enough, right? He wanted to hit the living you-know-what out of the ball, and that's why when his speed picked up, his accuracy went down. So what was happening is he didn't have that rotation. He would either chicken wing, or probably a combination of the both. He would chicken wing, and then he would come up out of posture, right? The hardest part about that is you have to be very, very good to be able to get back into posture as the ball arrives. So that was the part of his swing faults and what I got to looking at. So as I'm working with him, I'm finding external rotation stiffness, internal rotation stiffness, One of the other things that we found was that he had a really hard time neurologically. We call it disassociation. Neurologically, he was not able to disassociate his pelvis from his trunk, right? And you will have heard through either a golf instructor or YouTube videos that it is very important for power that you are able to move your hips just a little bit before you move your trunk, right? You don't have to have a great, huge flexibility, although it helps, especially in your backswing. But what you definitely need to be able to do to get that whip effect to really hit the ball and do it consistently is to be able to turn your hips while your shoulders stay stable, so that as you come through, you can turn, and then everything kind of whips through and hits the heck out of the ball, right? So because this guy had stiffness in his hip, because he was getting back pain, and it may have been before all of this, right? Chicken or the egg, we don't know. He was getting an issue where when he turned his hips, he turned his body, right? He was not able to start with that good kind of takeaway and really kind of stop his hips while he turns his shoulders. And then consequently on the way down, he wasn't able to start his hips and get into that good position to hit a ball. His hips would just be there. And then what would happen is he would try and get around, but he couldn't. He had to go outside to get through the ball because his hips were in the way, right? So what we did with this gentleman is we worked on some drills that allowed him to start turning his hips without his shoulders, right? Really basic things. He'll start holding on to something to see if he can do it. And then once he masters that, see if he can do it like that, right? And then we start adding weights. We do rotational strengthening, all the stuff you see in the gym. But this is a big issue that I see with golfers, is that they will see the big rotational strengthening things on the Instagram videos or in the gym, and they'll start turning and throwing balls around and all that. But they've never actually fixed the issue of their brain doesn't know how to turn one without the other, right? So that's where PT usually comes in, and with our background in neuroscience and our background in orthopedics, to be able to kind of solve that for somebody quickly. So for this gentleman, we gave him that to do, gave him some stretching for the hips, gave him some stretching for the shoulders, and then we sent him back to his pro, right? And we said, okay, go back to your instructor and say, let's work on this. I've been working on some stuff physically, and then go. So he went out to the course, and all of a sudden, these things became a lot easier. Now, he's not a scratch golfer. So with scratch golfers, sometimes what will happen is they will figure out the body thing, and all of a sudden they call me and they say, oh, I've gained 10 yards on my irons. Great. People who are really skilled, been playing since they were kids, that little change, they'll know how to do that, incorporate it, and then they're hitting the crap out of the ball, right? For someone who isn't, this is where a pro really comes in handy, is that I will send them back to the pro and say, here, body's a lot better than it was before. Now you work on coordination and repetitions and swing thoughts and all the stuff that you need to do to make him able to reproduce that swing consistently on the course. So for this gentleman, he was able to do that. He's still working on the club head speed because, of course, he has the physical body to be able to do that now. But he still needs to put the reps in with his pro to make it so that he knows exactly what to be doing with his hands in certain part of the swing, and to get the repetition down so that it happens all the time. But he's feeling a lot better. His play got better strictly just because his pain got better, right? But the hope is we'll see here in another 12 weeks, 16 weeks of working with this pro consistently that he'll actually be getting pretty consistent club head speed gains too. So this is just a case study that I wanted to share with you guys about a real life amateur golfer that I've been working with, and how a golfer, a PT, and a golf pro can work together to help out the player. Player's happy, everyone's happy. Right? So hopefully this was helpful. And if you